Thank you very much for the introduction. I only have 10 minutes, so let's go. First of all, I would like to start with the problem. We have a huge clinical unmet need in HPV-related cancer, which altogether are 5% of all cancers. And they are specifically in oropharyngeal cancer, about 106,000 new cases a year. So the huge clinical unmet need is that the standard of care still relies on very old therapy like radiotherapy and cisplatin, which are highly toxic for the patients. And another thing is that most of the patients are unfit for these kind of therapies. So we have Selisistat, which is a first-in-class selective SIRT1 inhibitor with a dual activity that we have demonstrated and patented as a chemo radiosensitizer, which is able to restore p53 in this kind of tumor. So without diving too deep in the mechanism, just a quick overview. In the tumoral cell, the p53 is deacetylated by SIRT1, and this deacetylation enables the oncoprotein from the viruses, which are E6 and E7, to silence p53, which is not mutated, but just silenced. So we are gonna inhibit SIRT1 with Selisistat. The p53 is not deacetylated anymore, and the virus cannot attack the p53, so we are able to restore p53. And of course, if we restore p53, chemo and radiotherapy are much more effective. So we did our preclinical studies in our lab, in vitro and in vivo mouse tumor models. We have a license to acquire the phase I dossier with all the clinical trial already done in healthy volunteers. So we are ready for a phase IIb clinical trial. So we are at de-risk, fast to close, asset ready for a phase IIb clinical trial. This is the trial that we want to do, a multicentric randomized double-blind clinical trial with two arms. The first one is radiotherapy plus placebo. The second one will be radiotherapy plus Selisistat. We would like to enroll 80 patients across multiple centers. This is our intellectual property. We have exclusive coverage on the worldwide patent on Selisistat. The patent is guaranteed until 2041, and we have future opportunities to new biomarker-driven, which ctDNA and viral load, to submit new patent post-trial. So the market opportunity is about, our leading program is about the oropharyngeal HPV-related cancer, which are 70,000 patients a year potential targetable with our drug, but we are able to expand this indication on all the other HPV-related cancer, which are also in cervical, anal, vulvar, penile, etc., which all have, we have demonstrated that all have this p53 SIRT1 axis share, and we know that this axis is the main driver of this kind of tumor. So we have a total of 6.6 billion with the B total market. So our business model and strategy is very easy. We would like to advance Selisistat through a phase IIb clinical trial, and then we have a global pharma acquisition with a rapid cash return for investors. So we suppose to break even in 2030 after the clinical trial. We are looking for a soft round of 250K just to consolidate the advisory board and all the other things, and then we are ready for a Series A round of 80 million to complete the phase IIb clinical trial. This is our team. I'm Tommaso Landolfo. I'm a medical doctor. I'm the CEO of NoToVir. We have Professor Marco D'Andrea, Professor Santo Landolfo, which is our co-founder. We have a strong advisor team with Professor Marisa Garillo, which is the scientific advisor and also the inventor of the patent. We have Goran Westerberg, which is our regulatory affairs expert. Professor Vincenzo Capizzi, which is a professor of business and finance, is an expert in fundraising. We have also some clinical leaders already in our team, like Dr. Paolo Bossi from Humanitas, which is head of oncology. We have Professor Pierfrancesco Franco, which is head of radiotherapy in University of Eastern Piedmont. And then we have Professor Alessandro Gennari, which is also head of oncology in University of Eastern Piedmont. So this is our asset. This is a pipeline in a product across HPV-driven tumors. We have a clinically de-risked phase IIb ready asset with a multi-billion market cap opportunity with clear M&A exit. Thank you.